Hi, my name is Tiffany Chung, and I just won the Siemens Healthineers / Varian Student Scholarship through the AAMD Foundation. Thank you so much. I think that working in the clinic, it really helps to understand the terminology that is used in dosimetry school. As a radiation therapist, I had to learn the vocab that is used in imaging sciences and also in radiation oncology specifically, which was in itself a whole different language. And so working in the clinic, there is exposure to the terminology, and reinforcement of the understanding of what these terms mean. In dosimetry school, we go through a lot of grave detail about the different things, concepts, tools, people that we interact with in radiation oncology. And so having a working understanding of what the terminology relates to or refers to is really important. And so concepts come together much quicker if there is clinical experience as a radiation therapist. And that really does help ease the transition into dosimetry school and into planning. I also think that there is a much better, deeper appreciation for the planning process. As a radiation therapist who implemented plans, I didn't quite fully understand or appreciate the hoops or the challenges in planning for a patient. My job as a radiation therapist is to implement or to deliver the treatment plan, but despite the fact that I, in the back of my mind, knew that there are different ways to plan, I didn't quite understand how nuanced it was in order to create plans that were just perfect for a particular patient. So because I had the benefit of interacting with my patients and interacting with the rest of the care team, including the doctors, the physicists, the planners, the QA techs, et cetera, I have that knowledge of knowing and seeing firsthand what my patients went through at various different times of their treatments, whether it was beginning of their treatment, middle, or end of their treatment, what pains they had, what was different from their perspective, interacting with the physicists or interacting with the planners about what they wanted me to focus on when I did QAing or when I did, when I would do pre-treatment imaging. I appreciate that more. I appreciate more their perspective now that I'm in dosimetry school because despite the fact that I was a working therapist in the clinic, I knew I was delivering a quality plan because I had faith in my care team and I had faith in the equipment that I was using. But because my main focus was operating the equipment and also getting the patient through delivery of the treatment, I didn't spend the time to really understand the planning side of things. And so now being in dosimetry school, it's almost a full circle for me to understand in more detail the nuances and the challenges, but also the satisfaction of creating high quality treatment plans that have the capacity to cure patients.